Hi, Susannah Fox. Where are you currently working?
I work at the Pew Research Center.
And what do you research there?
I research the social impact of the internet, and my passion is the social impact of the internet on health and healthcare.
So that brings us to where we are here in DC at the 2014 Health Datapalooza, where you just shared a conversation over the course of the day. Seems like this event brings together lots of your research interests with the people that are technologies that are involved. What were the high points of your day?
For me, it was seeing old friends and new. Um, it was seeing people who were here at the very first Datapalooza 5 years ago, who keep coming back and build the community. I think it's important to honor the past and remember the people who were here at the beginning. But I also really like that most of the people at this year's Datapalooza were first timers, people who, that's how a movement grows. And I saw a lot more, in the beginning there was always entrepreneurs mixed in with feds, and it just got bigger and bigger and bigger. And I think that's a good thing. I think that there should always be a really almost equal mix of developers and entrepreneurs and VCs, as well as all the entrepreneurs within the federal government.
So, what does this all mean to all of the patients in the U.S. or beyond? What's the impact of what's being discussed here?
So, frankly, that's the critique that I have. That the very first Health Data Palooza, you and I both wrote about how if health data is going to be like weather data, is that really going to help people? You can't do anything about the weather. Can you do anything about the social determinants of health? And that's so much of what the data transparency exposes. Um, and what I was looking for coming into this year's Health Data Palooza was I didn't really want to hear that much more. I think it's great that the transparency movement is going forward. I think it's well established. Transparency to me is the ship is sinking. How fast is it sinking?
Mm-hmm.
What I wanted to hear this year is who's building a lifeboat, or even just throwing a lifeline, just helping out, a single segment of the market. And what I'm really excited about is that there were a lot of people who were building lifeboats and throwing lifelines to real patients who were starting to say, we're not going to wait for them to boil the ocean. We're not going to wait for interoperability. We're going to figure out a way to help people connect with drug information or help people get their records digitized.
So when I think about weather data, I also think about GPS data, which is the other canonical
Yes.
example of data releases that change the world. And both of them enable you to make decision, right? Is it going to rain or not? Is it going to snow or not? Should I think about not driving today because of how bad this weather is going to be? Is there a tornado coming? It gives you a map to make decisions about that part of the world. You combine that with your GPS and you know where you are and where you are relative to maybe a storm on the horizon. If you apply that to health data, right, maybe there's some metaphorical crossover. There's a risk if I take this drug with that drug. This doctor has a high incidence of success or failure. This hospital has higher infection rates. Is that a map, maybe, of decisions so you at least can calculate risk?
I think so, and I think that's where we're headed. A question that I have about the currency of the data is that it is different from the weather data, which is real time. And, I think that there are some stable trends that can be exposed through transparency of health data. For the drug interaction question is a great one. That if you can expose that data to consumers and make it easy for them to search and say, oh, I realize that I shouldn't take those two drugs together, then that's data that's actually pretty stable. Because, for example, I was just learning about the amazing initiative OpenFDA. That data, just like has always been, any public data that they have, that they're releasing, is a year old. And so that's great. That's a revolution. That's never been done before, that it's released as an open API. But it's a year old. So we're not talking about real-time data. So I think that I think there are absolutely exciting applications. And what was really neat was to see this community, you know, bringing forward some new ideas. I really do think that it's still in an adolescent phase where it needs to be taken seriously, just as you would take a teenager seriously, and they can be brilliant one minute and stumble the next. And that's really how I see this community. I can't wait to see what happens next.